Congressman, thank you very much for joining us tonight. How surprising is it to have Marjorie Taylor Greene on your side now in the shutdown?
Well, thanks for having me, Lawrence. I'm somewhere between a broken clock is right twice a day and rechecking my position. But she's right. The heat is definitely on the Republicans right now. I just went around yesterday and did 4 town halls in Derek Van Orden's district, my neighbor's district, a Republican member who's never done an open public town hall. I did a press conference today with 25 Democratic state legislators in Madison. And we're all hearing the same thing. People are concerned about rising healthcare rates. 15 million people are going to lose healthcare because of the big ugly law, but everyone is going to pay more because of that law as well. And the rates are coming out right now in mid-October in places like Wisconsin and across the country. And people already are seeing their rate increase. Lawrence, I had an employer tell me Friday night they got their new rates for next year, 41% increase. And that's what we're fighting for. And Marjorie's just kind of stating the obvious what we've been.
Also in those town halls, are you hearing about what tariffs are doing to the prices in people's lives?
Yeah, absolutely. I mean, so housing has kind of been inflated in cost for a while, but people are now paying more for groceries because of Trump's tariff tax on the American people. People are paying more for durable goods, and come holiday season, people are going to be paying a lot more for gifts and things like that. Energy went up because of what they did in the big ugly law, getting rid of some of the work that we did around wind and solar and working with utility companies. And now healthcare costs are, for one employer, going up 41%. And we know that in Wisconsin, a 60-year-old couple making $85,000 a year, according to the Kaiser Foundation, will see on average a $17,000 increase next year in their healthcare premium. So when you're paying more for absolutely everything, and Donald Trump said the reason he was getting elected was to lower the cost of goods, people can smell that something's not right. And we're absolutely hearing about tariffs, healthcare costs, and ICE, probably the top 3 issues.
And as we go forward in this shutdown, what do you think is the significance of the Marjorie Taylor Greene defection? She's not just anyone in the House of Representatives. She's not somebody who they ignore.
Well, I think she's the only person saying it outwardly. I think there's plenty of other Republicans who are hearing this. There's a reason they're not doing town halls, right? If you really did something great, you would go and brag about it around your district. You'd get a megaphone, you'd get on everyone's rooftop and talk about it. But if you're hiding in your basement instead, that doesn't pass the smell test. In places like Wisconsin, we get it. So yesterday, I went to places like Richland Center, Viroqua, Wisconsin, La Crosse, Wisconsin, Eau Claire, and had town halls for an hour in every single one of those cities in my neighboring Republican member's district, because he's never done an open public town hall for 3 years, and people want to be heard. They're really concerned, especially on healthcare. Also, we have to remember during that big ugly law, they triggered a $500 billion cut to Medicare, and that also affects us all. So if we're all affected by cuts to Medicare, we're all going to have our rates go up. 15 million people between Medicaid and the Affordable Care Act are going to lose their health insurance. Guess what? That's a huge problem. I got 85 calls last week about the government shutdown, but I have 14,435 calls this year on healthcare. I can tell you what people are worried about.
Congressman Mark Pocan, thank you very much for joining us tonight.